Welcome to our NPTE Question of the Day series, presented by Typical PT. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. The question is, the physical examination reveals jugular venous distension, an S3 heart sound, and crackles in the lungs. Which of the following pathophysiological conditions is most closely associated with the presence of an S3 heart sound? A. Heart failure with reduced ejection fraction, HFrEF. B. Pulmonary hypertension. C. Acute myocardial infarction. D. Pericardial effusion. Go ahead and pause the video right now. Think through the logic and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice A, heart failure with reduced ejection fraction, HFrEF. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Answer choice A is correct because the presence of an S3 heart sound is commonly associated with heart failure with reduced ejection fraction, HFrEF. The S3 heart sound, often referred to as a ventricular gallop or to-lub-dub, is an abnormal sound that occurs after the S2 sound. It is due to rapid ventricular filling, early diastole, into a dilated or stiff ventricle, which causes the ventricular walls to oscillate. The abnormal section of the heart sound diagram labels S3 as T after S2. The overall clinical presentation, jugular venous distension, a sign of increased central venous pressure, crackles in the lungs, fine crackles are associated with heart failure, and the S3 heart sound is the classic triad of advanced congestive heart failure, HFrEF. Now, let's look at why the other options are incorrect. Answer choice B is incorrect because pulmonary hypertension affects the right side of the heart. It does not typically cause an S3 heart sound. It may lead to right ventricular failure and other signs, but is less directly related to the S3 sound. Answer choice C is incorrect because acute myocardial infarction primarily affects the heart muscle and may cause other heart sounds or symptoms, but the S3 heart sound is not a primary indicator of an acute MI. Answer choice D is incorrect because pericardial effusion usually leads to a muffled heart sound and may cause a distant heart sound rather than an S3 heart sound. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.